Have you ever wondered if the subtle changes in your body could be signaling something more serious? Diabetes is a condition that can sneak up on you, with both mild and severe symptoms that are easy to overlook. Today, we delve deep into the 13 mild and 9 severe signs of diabetes that everyone should be aware of. Understanding these signs can be the key to early detection and management, potentially saving you from the more severe complications associated with this common, but often misunderstood condition. So, stay tuned as we uncover the surprising indicators that could be warning you about your health. Your journey to better understanding starts here. Let's first start with the 13 diabetes mild signs. 1. Frequent urination. Frequent urination, medically known as polyuria, is one of the hallmark symptoms that can signal the onset of diabetes. Polyuria occurs as a result of excessive glucose in the bloodstream. When the kidneys filter this surplus glucose, it is subsequently excreted through urine, leading to an increased frequency of urination. Individuals experiencing diabetes might notice that they need to urinate more often than usual, and this can be especially noticeable during nighttime, a condition referred to as nocturia. It's not uncommon for someone with diabetes to wake up multiple times during the night with an urgent need to visit the bathroom, disrupting their sleep and overall well-being. 2. Increased thirst. One symptom that often goes hand in hand with frequent urination is known as polydipsia, which refers to an increased feeling of thirst. This condition occurs because, as the body loses fluids through urine, it sends signals to the brain that trigger a sensation of thirst as a way to replenish the lost water. For individuals with diabetes, this can manifest as an insatiable thirst, leading them to drink significantly more fluids than they typically would. Imagine constantly feeling the need to drink more water, yet never feeling fully satisfied. This persistent thirst is the body's attempt to compensate for the excessive fluid loss. And while it might seem like a simple inconvenience, it actually serves as an important indicator. When this symptom is observed alongside polyuria or frequent urination, it should not be taken lightly, as it could be a potential warning sign of diabetes. 3. Unexplained weight loss. Unintended weight loss can be a significant early warning sign of diabetes, particularly in cases of type 1 diabetes. When the body is unable to utilize glucose for energy due to a lack of sufficient insulin, it starts to break down fat and muscle tissue as an alternative energy source. This metabolic shift leads to a considerable and often unexplained reduction in body weight. While losing weight might initially seem like a positive change for some, it is essential to understand that in this context, it could be a symptom of an underlying health condition. Diabetes is a serious disease that affects the body's ability to regulate blood sugar levels, and early detection can be crucial for effective management. 4. Fatigue. Chronic fatigue is a prevalent and often debilitating symptom experienced by individuals with diabetes. This fatigue arises when the body's cells are unable to effectively absorb glucose, the primary source of energy. As a result, these cells are left starved for energy, significantly impairing their ability to function at their best. Even with adequate rest, individuals may find themselves battling persistent tiredness and an overwhelming lack of energy. The fatigue associated with diabetes is multifaceted. It encompasses both physical and mental exhaustion. Physically, one may feel an unrelenting heaviness or weakness, making everyday tasks seem insurmountable. Mentally, the fatigue can manifest as difficulty concentrating, memory lapses, and an overall sense of cognitive fog. This dual impact of fatigue can profoundly affect an individual's overall quality of life, diminishing their capacity to engage in daily activities and enjoy life to the fullest. 5. Blurred vision. Elevated blood glucose levels, often associated with diabetes, have the potential to cause noticeable and sometimes disconcerting changes in vision. One of the more immediate effects is the temporary alteration in the shape of the eye's lens, which can result in blurred vision. This occurs when excess glucose in the bloodstream attracts additional fluids into the lens. The influx of these fluids causes the lens to swell and change shape, thus affecting its ability to focus properly. While this blurring of vision can be unsettling, It is generally a mild and reversible symptom that can be resolved once blood sugar levels are brought back under control. However, it is important to recognize that persistent high blood glucose levels pose a significant risk for more severe eye complications. One such complication is diabetic retinopathy, a condition that can develop over time and potentially lead to vision loss if not managed properly. 6. Slow healing wounds. Individuals diagnosed with diabetes may often observe that their cuts, bruises, and other wounds take an unusually long time to heal. This seemingly minor symptom is actually a significant indicator of the condition, rooted in the body's elevated blood sugar levels. High blood sugar can disrupt the body's normal healing processes by impairing blood flow and compromising immune function, making the repair of tissues slower and less efficient. It is important to note that while this symptom might appear mild and easily overlooked, it should be regarded with careful attention. The prolonged healing of wounds can be one of the earliest signs of diabetes, signaling underlying issues with blood glucose regulation. Recognizing and addressing this symptom promptly can lead to earlier diagnosis and better management of diabetes, ultimately improving overall health outcomes. 7. Increased hunger. Polyphagia, or increased hunger, is another symptom associated with diabetes. Despite consuming adequate or excessive amounts of food, individuals with diabetes may experience persistent hunger. This occurs because the body's cells are unable to utilize glucose effectively, signaling the brain that more food is needed for energy. This symptom can lead to overeating and, in some cases, weight gain. 8. Numbness and tingling in extremities. As diabetes advances, many individuals might begin to notice a range of unusual sensations, particularly in their hands and feet. These sensations often manifest as numbness and tingling, which are hallmark signs of a condition known as diabetic neuropathy. Diabetic neuropathy occurs when prolonged high blood sugar levels lead to nerve damage, disrupting normal sensory functions. Initially, these sensations might present as a mild discomfort, something easily dismissed or overlooked. However, over time, they can become increasingly pronounced, evolving into a persistent and often bothersome issue. This progression can significantly impact one's daily life, affecting not only sensory perception, but also coordination and balance. Imagine trying to grasp objects or walk steadily while dealing with constant tingling or numbness. It can be quite challenging. Understanding and addressing these symptoms early on is crucial. Not only can early intervention help manage discomfort, but it can also prevent further complications associated with diabetic neuropathy. This underscores the importance of regular monitoring and maintaining blood sugar levels within a healthy range. Moreover, consulting with healthcare professionals can provide valuable strategies and treatments to mitigate these symptoms and enhance overall quality of life. 9. Recurring infections. Individuals living with diabetes often face an increased risk of infections due to a compromised immune system. This vulnerability means that they are more prone to common infections such as urinary tract infections, yeast infections, and skin infections. These types of infections not only occur more frequently among people with diabetes, but also tend to take longer to heal. This phenomenon highlights the critical need for vigilant blood sugar management and timely medical intervention. Maintaining optimal blood glucose levels can significantly reduce the incidence of infections and improve overall health outcomes. It is essential for individuals with diabetes to work closely with their healthcare providers to develop and adhere to a personalized diabetes management plan. This plan may include regular monitoring of blood sugar levels, a balanced diet, appropriate exercise, and possibly medication. 10. Darkening of skin. Acanthosis nigricans is a dermatological condition distinguished by the appearance of dark, velvety patches of skin. These distinctive patches commonly develop in areas where skin folds, such as the neck, armpits, and groin. Though visually striking, acanthosis nigricans is typically not harmful on its own. What makes this condition particularly significant is its strong association with insulin resistance, a key indicator of type 2 diabetes. When the body's cells become less responsive to insulin, it can lead to elevated blood sugar levels, prompting the pancreas to produce more insulin. This overproduction of insulin is believed to stimulate skin cells, leading to the characteristic darkening and thickening observed in acanthosis nigricans. 11. Gum disease and oral health issues. Diabetes can have profound implications on one's oral health, significantly elevating the risk of developing gum diseases such as gingivitis and periodontitis. When blood sugar levels are consistently high, it can create an environment in the mouth that is conducive to the proliferation of harmful bacteria. These bacteria, in turn, can lead to inflammation, bleeding, and receding gums, which are hallmark symptoms of gum disease. The relationship between diabetes and oral health is bidirectional. Not only can diabetes exacerbate gum disease, but severe gum disease can also make it more challenging to control blood sugar levels. This creates a vicious cycle that underscores the importance of diligent oral care for individuals with diabetes. 12. Foot problems. Foot problems are a prevalent concern among individuals living with diabetes due to compromised blood circulation and potential nerve damage. These issues can manifest in various ways, including swelling, redness, and persistent sores that fail to heal properly. If these symptoms are ignored, they can escalate into more serious conditions, such as diabetic foot ulcers and infections, which may ultimately lead to severe complications like amputation. To mitigate these risks, it is essential for individuals with diabetes to prioritize proper foot care and regular inspections. This proactive approach involves daily foot checks for any signs of abnormalities, maintaining good hygiene by washing and moisturizing the feet, and ensuring proper footwear to avoid unnecessary pressure or injury. 13. Itchy skin. Persistent itching, particularly in the genital area, can be an important indicator of underlying health issues, including diabetes. Individuals with high blood sugar levels often experience dry skin and compromised blood circulation, which can contribute to significant discomfort and irritation. This persistent itching should not be ignored, as it may point to more serious conditions. Moreover, individuals with diabetes are more susceptible to fungal or yeast infections. The body's elevated glucose levels create an environment where these infections can thrive, leading to further skin issues. These infections often manifest as persistent itching and should be addressed promptly to prevent complications. Now let's move to the 9 diabetes severe signs that can sneak up on you and can be easily overlooked, but they could be a very serious warning about your health. 1. Diabetic ketoacidosis. Diabetic ketoacidosis is a serious and potentially life-threatening medical condition that requires prompt attention. It occurs when the body starts producing high levels of ketones, which are acidic compounds leading to a dangerous state known as metabolic acidosis. While diabetic ketoacidosis is most frequently associated with individuals who have type 1 diabetes, it can occasionally occur in those with type 2 diabetes, particularly under certain stressors like illness or inadequate insulin therapy. Recognizing the symptoms of diabetic ketoacidosis is crucial for timely intervention. Some of the hallmark signs include severe abdominal pain, persistent nausea, and vomiting. A person may also experience rapid, deep breathing, which is the body's attempt to counteract the acidosis. Additionally, a distinctive fruity odor on the breath is often noted, which is due to the presence of acetone among the elevated ketones. 2. Hyperglycemic hyperosmolar state. Hyperglycemic hyperosmolar state is a serious and life-threatening complication associated with type 2 diabetes. This condition is characterized by alarmingly high blood glucose levels coupled with severe dehydration. Unlike diabetic ketoacidosis, another acute complication of diabetes, hyperglycemic hyperosmolar state does not result in the production of ketones, substances that are produced when the body burns fat for energy. The symptoms of hyperglycemic hyperosmolar state can be quite pronounced and may evolve over days or even weeks. Those affected often experience extreme thirst and a persistently dry mouth, indicative of significant fluid loss. Additionally, confusion and disorientation are common and can escalate into more severe neurological deficits, such as weakness or even seizures. 3. Severe hypoglycemia. Hypoglycemia, commonly known as low blood sugar, is a condition that can affect individuals with diabetes, particularly those who are on insulin or other medications designed to lower glucose levels. This condition can be quite serious as it may result in symptoms such as confusion, loss of consciousness, and even seizures if not addressed promptly. Understanding and identifying the early signs of hypoglycemia is crucial for people living with diabetes. These initial symptoms often include shakiness, sweating, and irritability. Recognizing these signs early allows individuals to take swift and appropriate action to elevate their blood sugar levels and prevent more severe complications. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. 4. Loss of consciousness. In extreme circumstances, where diabetes is not adequately managed, the individual may face serious health risks, including the potential for loss of consciousness or even falling into a diabetic coma. This perilous state can be triggered by both severe hyperglycemia, excessively high blood sugar levels, and hypoglycemia, dangerously low blood sugar levels. Hyperglycemia can occur when the body lacks sufficient insulin or cannot effectively use the insulin it produces, leading to an excessive accumulation of glucose in the bloodstream. On the other hand, hypoglycemia typically arises when there is too much insulin or insufficient glucose intake, causing blood sugar levels to plummet to dangerously low levels. 5. Cardiovascular disease. Diabetes is not merely a condition of elevated blood sugar levels. It is also a significant contributor to an increased risk of cardiovascular disease. This includes serious health issues such as heart attacks, strokes, and peripheral artery disease. The intricate relationship between diabetes and cardiovascular health arises from the damage high blood sugar levels can cause to blood vessels. Over time, this damage can lead to the buildup of plaque, a condition known as atherosclerosis, which narrows and hardens the arteries. 6. Kidney disease. Diabetic nephropathy, also known as diabetic kidney disease, is a prevalent and serious long-term complication of diabetes that significantly impacts the kidney's ability to effectively filter waste products from the bloodstream. This condition arises due to prolonged exposure to high blood sugar levels, which can cause damage to the delicate filtering units within the kidneys, known as glomeruli. As the glomeruli suffer damage, their efficiency decreases, leading to the progressive deterioration of kidney function, a condition referred to as chronic kidney disease. If left unaddressed, this can escalate to severe stages, ultimately resulting in kidney failure. This progression underscores the critical importance of diligent and regular monitoring of kidney function for individuals living with diabetes. 7. Eye complications. Diabetic retinopathy is a serious eye condition that arises when elevated blood sugar levels cause damage to the blood vessels in the retina. The retina, which is located at the back of the eye, plays a crucial role in vision by converting light into signals that are sent to the brain. When these blood vessels are compromised, it can lead to a range of vision issues, and if the condition is left untreated, it can ultimately result in blindness. One of the most concerning aspects of diabetic retinopathy is that it may not present any noticeable symptoms in its early stages. This asymptomatic nature makes regular eye examinations essential, as they allow for early detection and prompt management of the condition. By catching diabetic retinopathy in its initial phases, healthcare professionals can implement treatment strategies that can help preserve vision and prevent further damage. 8. Nerve damage. Diabetic neuropathy is a prevalent and often serious complication associated with diabetes, arising from the persistent elevation of blood sugar levels that progressively damage the nerves. This condition can impact various regions of the body, manifesting through a range of symptoms such as numbness, tingling sensations, pain, and muscle weakness. Everyone's experience with diabetic neuropathy can differ, as there are several distinct types of this condition, including peripheral neuropathy, autonomic neuropathy, proximal neuropathy, and focal neuropathy. Peripheral neuropathy is the most common form and primarily affects the feet and legs, and sometimes the hands and arms, leading to discomfort and mobility issues. Autonomic neuropathy, on the other hand, can disrupt the functioning of internal organs, resulting in challenges with digestion, urinary function, and cardiovascular health. Proximal neuropathy is rarer and targets the thighs, hips, or buttocks, causing weakness in the legs and difficulty with movement. Lastly, focal neuropathy is characterized by sudden, isolated nerve damage that can lead to acute pain or muscle weakness in specific areas, such as the head, torso, or limbs. 9. Skin conditions. Individuals living with diabetes often face a higher likelihood of encountering various skin conditions. This increased susceptibility is due to the effects of elevated blood sugar levels on the body's immune system and skin health. Among the most common skin issues faced by those with diabetes are bacterial infections, such as styes and boils, fungal infections like athlete's foot and yeast infections, persistent itching, and poor wound healing, which can lead to more severe complications if not properly managed. In addition to these general problems, there are several skin conditions that are particularly associated with diabetes. Diabetic dermopathy, characterized by light brown scaly patches on the skin, usually on the shins, is one such condition. Another is necrobiosis lipoidica, which causes red-yellow lesions, often with a shiny surface that may become itchy and painful. Eruptive xanthomatosis, another diabetes-related skin condition, presents as firm, yellow, pea-like enlargements on the skin, typically surrounded by red halos and often found on the backs of hands, feet, arms, legs, and buttocks. Understanding the signs and symptoms of diabetes, from mild to severe, is essential for early detection and effective management of the condition. Recognizing these warning signs can prompt individuals to seek medical attention and take proactive steps to control their blood sugar levels. By maintaining a healthy lifestyle, regular monitoring, and adhering to treatment plans, individuals with diabetes can lead a fulfilling and healthy life. Remember, if you or someone you know is experiencing any of the symptoms mentioned in this guide, it is important to consult a healthcare professional for a proper diagnosis and treatment plan. Early intervention can make a significant difference in managing diabetes and preventing long-term complications. If you found this video helpful, please share it with others. Your knowledge and awareness can contribute to a larger, safe, and healthy community. If you have any questions, experiences to share, or thoughts on this video, feel free to leave a comment below. Your input and engagement are valuable to us. Thank you for watching.